day, friends of Buzzy. I am Dr. Amy Baxter, and I'm going to tell you everything that I know about coronavirus at this point, 6 months into our relationship with this new vaccine, or new virus. So, first of all, my background is I'm a pediatric emergency doctor. I invented a frequency that causes pain to be blocked. I made Buzzy, I made Ladybuzz. I then discovered that this frequency will block pain from injuries and surgeries, so I've been working on VibraCool device. My main NIH research right now is in low back pain and opioid reduction, and I have been completely distracted by coronavirus. So as we are now at a place where we really just need to figure out which treatments work, we know a lot more about this virus than we did 6 months ago, and it's time for me to quit being completely obsessed with it and to move on to what I'm supposed to be researching in my life and in my job. For this reason, I would like to take this moment to summarize everything that I know about coronavirus, everything that we are not yet sure about as scientists, and talk a little bit about what you can do as New York opens and other places open to keep yourself safe. All right, buckle up, it's gonna be fast. Here we go. Here's what is known about coronavirus. So first of all, there's about a 1% case fatality rate. This is less than the 3% with Spanish flu. It's about 10 times to 20 times what there is with normal flu. It lasts about 3 to 4 weeks. The first symptom for most people is cough, 81%, then loss of smell, loss of taste, nasal congestion, that's all in about 71%. 3 weeks later, you still have about 26% of people who can't smell, and you still have about 30% of people who have a cough. So this thing sticks around and lasts for a long time. What we also know about it is that 68% of the people who get coronavirus got it from somebody who is asymptomatic. So whether or not they were not ever going to be symptomatic, or whether they were pre-symptomatic, most of the spread of coronavirus happens when people don't know they're sick. This is why a mask protects me and protects you, but mostly it protects you, because this means that if I'm sick and I cough or I talk or I sing, that the coronavirus is going to get stuck in here and not go out. We also know it's a very big virus, 120 nanometers. This is a big deal because reasons I will tell you. But for one thing is, if it's a really big particle, it means it's harder for it to be floating around in the atmosphere for a long time. It means that if it gets humid, it gets heavier faster and falls down. And it also is very related to how it spreads. Okay, so how does it spread? We do know this now. So the likelihood of getting ill from coronavirus is related to your viral load. So how much of this virus do you get that your immune system has to cope with? And we now know it's a combination of the time of exposure and the intensity of the exposure and the risk that you're at. So let's think of this as a giant field. The time of exposure is how long this is raining down on your field. How long is it coming down? The intensity is obviously, are you getting a full-on cough in the face? Is there just a dumping of this from a plane that's spraying chemicals? Or is this just a little bit at a time that's coming down? This is kind of why being outside in the wind makes you less likely to be able to get coronavirus, because the molecules are spreading around, they're not stuck in one place, raining down on your field. So the risk is probably the biggest and weirdest thing, and this is where some of the biggest tips for prevention have come from. So who is at risk? Well, it turns out that it's almost exclusively related to something called an ACE2 receptor. So you've seen the picture of coronavirus, it's got that little spiky thing. The spiky thing pops like a ball and socket into the ACE2 receptor. So who has more ACE2 receptors? Well, old people do. You get more as you get older. Somebody who's over the age of 70 has 10,000 times the risk of dying from coronavirus if they catch it than someone who's 15. So being old increases your number of ACE2 receptors. It also increases the area in your nose. Turns out that the place that coronavirus tends to be able to attach on and go in is your nose. Now, one thing that's unknown is how much can you get from your eyes. Paper this morning said that of 543 people, only 3 of them had eye symptoms as their first exposure, and only about 4% of them had eye symptoms at all. I think we are going to find that when people get it through their eyes, it's because it then goes through their tear ducts into the nose. That also kind of makes sense because the place in your nose where you do smell is really close to the top inside, which is where the tear ducts drain in. So that could make sense. Nonetheless, getting it into your mouth is fractional. It's the nose. So males have bigger nose cavities, and there's a bigger field for the virus to land on and start replicating. People who are African American or of African ancestry, there are a lot of other reasons why they may have more ACE2 receptors, but they're also more able to collect large molecules. So it may be that that's one reason why there's more severity in the African American population. Obviously, there are others, underlying conditions, hypertension. So being constantly stressed, as most of the African Americans in America are, that increases your blood pressure over time. If you're on an ACE inhibitor, turns out that actually probably is protective. So in the studies, people on ACE inhibitors for hypertension have tended to do a little better. Stay on it. People who are on ACE blockers have not done as well, but the doctors and the medical advice now is basically, if you're on an ACE inhibitor or an ACE blocker, just stay on it. The control of your blood pressure is more important than any possible chance of mitigating coronavirus. If you really care about it, ask your doctor about calcium channel blockers. But other big risk factor, obesity. That's something that increases ACE2 receptors. There's a possibility that once you go to a plant-based diet or start losing weight, that the ACE2 receptors actually will diminish in number, but I don't have solid data on that. But just because you're obese now doesn't mean you should give up. Just start eating healthy now, and it seems like that may have a fast effect on decreasing the risk of severity. All right, immunocompromise. Turns out that if you are on a T cell or a cytokine blocker for rheumatoid arthritis or for Crohn's disease or for psoriasis, those people actually are not getting as sick with coronavirus and are much less risk of dying. So this kind of goes to what else we know about coronavirus, in that the big issue is how your immune response behaves. So when the immune system has a chance to go haywire, that's when you get really sick. So with all of this put together, what else do we know about prevention? Another paper came out today, actually published, not in pre-press. Hydroxychloroquine doesn't help. It doesn't do prevention. It doesn't make you better faster, and it actually does cause more people to get sick. Yeah, they pulled a couple papers from Lancet and New England Journal. There's another paper, 11,000 people. Hydroxychloroquine was a red herring, and it's really frustrating that we've wasted so much time going down that rabbit hole. What may be helpful is something called tocilizumab. Basically, anything with an mab at the end of it is probably going to be something we're using when this comes back in the fall. All right, vitamin D, zinc may be helpful with prevention. Certainly, if you're low on vitamin D, take it. Nose stuff. So this is what we do know. There are now 13 studies that are registered in clinicaltrials.gov looking at varying degrees of going to where the virus is and hangs out. Thing is, the virus takes 5 days of invading your cells and replicating and making more before it starts tracking down your throat to your lungs, if it goes there. So if we can get rid of the viral load while it's still in your nose, then that is a logical way to decrease the severity and possibly even decrease the possibility of getting it. So what am I doing now, knowing what I know, for prevention? First of all, if I'm going to go into a place that is crowded, has still air, and is likely to have a lot of different people over time that I can't contact trace, I have invested in nose clips. So if I can't breathe in through my nose, then I'm not inhaling any viral particles through my nose. So some of these 14 studies are looking at gargling to see whether or not using mouthwash or gargle or betadine, if you do breathe it in, will help get rid of it. There's no reason not to, but I do think that having a nose clip, I have learned that the plastic nose clips hurt like crazy and you break them if you try to make them fit a bigger nose, so I'm not into that. Some of the studies are looking at things like alcohol. They're looking at nasal squirts to see if squirting a little bit of either irrigation to kind of flush out any of the virus that's stuck there or to try to kill it. They're looking at that. None of these studies have results yet. Only 7 of them are actively recruiting. But as you saw me do before, I do think that the ones that are going to pay off the best are going to have a tidal wave rinsing out all of the viral load that's had a chance to accumulate. Again, the people who are getting coronavirus are usually family contacts or people who are in grocery stores being exposed to low levels over time, or healthcare workers who, even though they have a lot of protective gear on, are still exposed to a lot of layers over time. So if you can rinse out whatever's had a chance to accumulate, then you've got a much better chance of not having your immune system get involved and go haywire. So I started, when last you joined me, I started using NeilMed with betadine. So betadine is a 10% povidone iodine solution. And so what I know now, first of all, I'm impatient, so I'm much more likely to burn myself on this than I am to have it be too cold. So I am now making a big boiled pot the night before and filling up a bunch of receptacles. What I know now is that it really doesn't matter what percent of this you use. A paper came out about 2 weeks ago, even 0.2% rinse of betadine for a minute kills coronavirus. So I had been putting in a half a teaspoon of this with about a teaspoon of baking soda. The baking soda was added for 2 reasons. One, because it seemed likely that the pH, the alkalinity or acidity, influenced whether or not the virus could fuse, and also because betadine is a pH of about 4.5, so that's acidic. It's not as acidic as midazolam or battery acid, which are both about 3.3, but it's still pretty acidic. So the good news is that adding baking soda does not make it no longer effective. It's still a good virucidal, but the question is whether or not, if you're doing a whole bunch of rinse, do you need it? Bottom line, I'm still using a half a teaspoon of this. I would not be surprised when we come to the end of all these studies and we know the results that if you use a spray, you may need to have something virucidal like betadine. But if you're doing a big irrigation, this is probably a tidal wave that is flushing that field of viral particles away so that you don't need to worry about it. What I've also learned is that if you're going to use this, I think going for it in the shower is good because it is messy, and if you put hot water from the shower in a mug and then let it sit a couple of times and swirl around, it gets warm enough so that you're not really uncomfortable, but you're definitely not going to burn yourself. So that I have learned. And I've also learned that if you go on TV or Facebook Live and you talk about doing nasal irrigation, you are likely to have somebody send you a Navage or alcohol or anything that people use for nasal irrigation. So for your viewing pleasure, this little guy came to me. So what it is it's got a fill line at the top, which holds about a cup. And right now it is cold, so it may not be as pleasant as otherwise. You've got to hold it straight up and down or it'll spill. Like that. It comes with batteries and a little thing to press to make it go. And it's going to go in one nostril and out the other. You can't really determine which way it goes. It's going to go in there, out there. Also, it's got really good branding on it. I mean, or instructions. It says, don't forget the salt pod. So if you're putting something in your nose with just plain water, your nose has a salinity, there's salt basically in your fluids. So because of that, if you don't put salt water in, then it's going to freak out your nasal tissues. If you're sick, in fact, you may want to put in extra salt, because then that will pull some of the fluid out of your sinuses. And again, 71% of people who get coronavirus do get inflamed sinuses, probably because that's where the action's happening. So Navage comes with salt pods, but they also come with eucalyptus pods that remind me a little bit of formaldehyde and doing my cadaver in med school. Not in an unpleasant way, but I'm just saying there's that. In fact, I'm going to use this one. So I'm putting in, I'm more of a baker, I'm more of a cook than a baker, so I'm just sort of going to eyeball, putting in about a half a teaspoon of this. You have to put this in first, because if you don't, it won't turn on. So I'm putting in my little Navage pod and snapping it. And it looks really cool, actually. You can see it swirling around. So the good thing about this is that in theory, it goes in one nostril, out the other, and into a little container. In reality, if you are not prepared for it, a couple times you might spew a little first. So I'm gonna do this. And there is really no way to make doing a nasal irrigation attractive. So I wouldn't do this if it weren't for your health. But gotta kind of put it there, make your nose real big. And you can't actually talk while it's going on. But I will say, I'm smooth at this now. I was not smooth the first 3 or 4 times. One thing I like about it is it's fast. So, just for you, baby. So, the things that they did with the betadine, it was like 1 minute. And I think this is probably faster than a minute. At the same time, I'm doing this because I believe in it, but it's not the most fun part of your day. So I don't mind it being done quickly. And I also like the fact that it's collected down here, so I can just dump it and it's not spraying out everywhere like the other one. I can't really make it go in the direction I want it to go, but I think that probably, again, with the tidal wave analogy, just as long as it's flushing everything out, you're good. All right. And then you can also send away and get a free little boat if you want to. So a couple other things here. What else is unknown? So I think the biggest unknown right now is, with a vaccine, are we going to get immune enhancement? The thing that's killing people is that the immune system starts eating holes in your lungs. The immune system starts making the inside layer of your blood vessels clot and string together. And this is why people are getting strokes. This is why we're having cardiac problems. This is why the children are having something that looks like Kawasaki's. It's a clotting platelet aggregation problem. So if we can stop the immune system from overreacting, then we can probably stop the severity and the dying from coronavirus. But vaccines can sometimes enhance your immune system. So I think that's the biggest unknown right now. We will get a vaccine of some sort, but whether or not the vaccine we get ends up making you more likely to get sick, or whether it makes you not get sick at all, I don't think we know that yet. Other thing we don't know is, of course, when it's going to come back. But I think this is really important. There are multiple studies now that show that coronavirus does not live as long on surfaces over 70 degrees, that coronavirus spreads best under 56 degrees Fahrenheit. And interesting things about ultraviolet light. Yeah, the more ultraviolet light you have, the more it kills it. The coolest thing that came out yesterday, 2 days ago, was an inverse relationship with pollen. So it may not be necessarily the temperature, but what this paper said was, perhaps independently, that when there are high levels of hay fever and high levels of pollen, your immune system may be better at clearing out viruses. So it may be that the seasonality of the flu and even the seasonality that we've seen so far of coronavirus is due to pollen. We will know the answer to this easily in the fall. For example, in Georgia, if the issue is temperature, it doesn't become an average of 56 degrees Fahrenheit until mid-November. However, pollen season is pretty much over the first week of October. So if our cases start spiking then, we'll know that this was more a pollen immune system related seasonality. If the cases are spiking in November, then it's probably temperature. The important difference is by fall, we should have some treatments that we know are able to reduce the severity. The whole reason that we were distancing was in part because we didn't know what was going to happen to the emergency departments. We didn't know how overwhelmed it was going to be, and we didn't know how easy it was going to be to prevent getting sick for people who are in emergency departments and healthcare workers. By the time this comes around again heavily, we're going to have a much better handle on that. So I hope that we won't need to shut things down in the winter and fall the way we did in the spring, because we'll have a much better way of reducing the risks of overwhelming our emergency departments and overwhelming everything else. So I hope that you have enjoyed learning. What solution? Oh, what solution is in the unit? I hope you've enjoyed learning everything that I know about coronavirus. I do know some other things that are more related to emergency department management, but that's not something you need to worry about it. So this is just distilled water. So it can be distilled, or you can boil regular water. And then if you're using NeilMed, they come with these buffered packets that you can add that has salt to make it so it's the same salinity as your nasal passages. The Navage comes with little packets that have salt, so it's the same salinity as your nasal passages. And then this is povidone iodine. This is what has been tested with coronavirus and obliterates it, squashes it like a bug. However, there are studies that are being done with neem oil, there are studies that are being done with chlorhexidine, there are studies that are being done with hydrogen peroxide. So if you're allergic to shellfish or iodine, then I would do a half teaspoon of chlorhexidine or hydrogen peroxide mixed in. And again, I think that I don't know, my gut right now is that probably if you are coronavirus positive, that rinsing with a fair volume 2 or 3 times a day is going to be the most important part. It's not necessarily going to matter what kind of antimicrobial you use, as much as the getting it in there and flushing it out. If there are any other questions, please feel free to send us questions at info@paincarelabs.com or orders@paincarelabs.com. At this point, I think that the amount of new knowledge that we're getting is going to accumulate slowly. Hopefully in America we've got warm enough temperatures and high enough pollen counts that will not overwhelm our emergency departments, so we can take a little bit of a step back. These are about $10 for 10 of them on Amazon, and I have no idea how much the Navage is, and the NeilMeds are about $9 and totally reusable, and they come with some packets of salt and baking soda to help bridge that gap. So I will be coming back from time to time talking about pain management, having Keith Cronin having him talk about different physical therapy ways to deal with pain when you're at home, and I am absolutely 100% sure it's going to be fine.